including inspection of the ears, otoscopic examination, and tests for hearing. In this video, the examiner will assess a healthy patient. Keep in mind that other patients may have the same normal findings or may exhibit normal variations or abnormal findings. For the next part of the ear exam, evaluate the patient's hearing. Occlude one of the patient's ears with your finger. Test the open ear by softly whispering numbers or words with two equally accented syllables from 1 or 2 feet away. Test one ear at a time. If hearing loss is present, gradually increase your voice volume until the patient can identify the spoken numbers or words. If hearing is diminished, do the Weber test, which checks for lateralization of bone conduction, and the Rinna test, which compares air and bone conduction. For each test, use a relatively high-pitched tuning fork, such as one of 512 Hz. To do the Weber test, place a lightly vibrating tuning fork firmly on top of the patient's head. Ask where the patient hears the sound, normally in both ears or the midline. To do the Rinna test, place a lightly vibrating tuning fork on the mastoid bone behind the ear. When the patient indicates that the sound is no longer heard, quickly place the vibrating fork close to the ear canal. Normally, the patient can hear vibration longer through air than through bone. Repeat the test on the other ear. Begin the ear examination by inspecting the auricle for position, size, and symmetry. Also, inspect the opening of the ear canal for discharge, swelling, or redness. If the patient has complained of ear pain or if you see signs of inflammation, check for tenderness by moving the auricle up and down and pressing firmly on the tragus. Pain on these maneuvers suggests inflammation of the ear canal. Also, press firmly on the mastoid bone behind the ear. Tenderness here suggests middle ear infection. Next, examine the ear canal and eardrum using an otoscope. To do this, select the largest speculum the patient's ear canal will accommodate. Position the patient's head so that you can see through the otoscope comfortably. Grasp the auricle firmly but gently, and in an adult, pull it up, back, and slightly out to straighten the ear canal. Then insert the speculum gently into the ear canal. Note any cerumen or earwax that may impair your view. Also observe for any discharge, foreign bodies, redness, swelling, or scaling. There should be none. Slide the speculum slightly down and forward and maneuver it until you can see as much of the eardrum as possible, including the pars flaccida if possible, and the margins of the pars tensa. Note the color and contour of the eardrum with its distinct cone of light. Normally, the drum is pearly gray. Also, note the position of the handle of the malleus and inspect the short process of the malleus. The handle of the malleus, with the umbo at its tip, crosses the drum obliquely from the cone of light upward toward the short process. Be sure to examine the other ear in the same manner.